Hello everybody, my name is Kassidy Klein. Today I'm going to be going over the Ebola virus. Here we begin with the signs and symptoms of Ebola. People generally experience 3 phases while battling Ebola. Phase 1 may include a fever, headache, possibly muscle aches and pains, all similar to the flu. During Phase 2, an infected person may experience stomach issues like vomiting, diarrhea, and abdominal pain. During the final phase, a patient will either begin to recover from the Ebola virus or they will begin to deteriorate. If a patient were to deteriorate after contracting Ebola, they would begin to bleed from their eyes, ears, mouth, and nose. This is generally what leads to the high fatality rate of 50% in Ebola patients. Since Ebola originates in animals and is spread through body fluids, anybody can get the disease. However, there are some people who are at a higher risk for Ebola. For example, those who work in hospitals or healthcare centers are at a much higher risk for contracting Ebola virus. Since people who are suffering from the effects of Ebola generally go to the hospital for treatment, and healthcare workers are required to care for all patients as part of their job, if they are exposed to the virus by the patient's blood, vomit, urine, or mucus, they are more likely to contract the virus. Furthermore, since Ebola originated in Africa and is much more prominent in the sub-Saharan region, anybody who travels to the sub-Saharan region may be at a higher risk for contracting the Ebola virus. Since their immune systems are not fully developed, children under the age of 5 years old can contract this virus and will begin to decompensate quite quickly. Furthermore, taking care of or living with a family member who has the Ebola virus increases the risk of contracting it. Since Ebola is spread through the bodily fluids, it is highly likely that throughout caring for the family member, somebody may contaminate themselves. These are 4 of the most commonly affected parts of the body. To begin with, the liver is in charge of prothrombin production. Prothrombin is a protein that aids in blood clotting. The GI tract is responsible for digesting nutrients and excreting the waste products. The adrenal gland is responsible for releasing adrenaline and norepinephrine, which play a large role in controlling blood pressure and heart rate. Lastly, blood vessels are small tubes throughout the body that are responsible for the transportation of blood to all of the organs in the body. However, all of these parts work differently when a person is infected with Ebola. For example, the liver struggles to produce the prothrombin protein. Therefore, the body struggles to produce blood clots. This correlates with stage 3 of the Ebola virus, where there is uncontrollable bleeding from the eyes, ears, nose, and mouth. Furthermore, the GI tract begins to overproduce waste products. This correlates with phase 2 of the Ebola virus regarding abdominal pain and diarrhea. The adrenal gland loses the ability to raise the blood pressure, which can become life-threatening, and it loses the ability to produce steroids. Steroids are generally the substance that helps to fight off flu-like symptoms, hence phase 1 of the Ebola virus. Lastly, the blood vessels are physically penetrated by the Ebola-infected cells, causing severe internal bleeding, ultimately leading to death. There are 2 ways to test for Ebola, which are a polymerase chain reaction, or PCR test, or a serologic test. A PCR test begins with collecting a sample of blood, mucus, or saliva. The sample is then combined with an enzyme called polymerase, which causes the sample's DNA to replicate billions of times. The machine will automatically indicate if a virus or pathogen is present. For the serologic testing, a sample of blood is placed in a chemical analyzing machine where antigens are already present. Using the sample of blood, the antibodies will either bind to the antigens properly or improperly. If there are improper bonds, then it is assumed that there is no virus present. If there are proper bonds, it can be assumed that the virus is present. The machine is able to identify the bonds and proceeds to identify the presence of the virus. This is an example of a polymerase chain reaction testing machine by Convergent Technologies. This is an example of a serologic testing machine by Empirica Medical Company. There are multiple ways that we can prevent the spread of Ebola, beginning with avoidance. Whether you are a healthcare worker or a family member, it is important to avoid contact with the body fluids of infected patients. This can include any of the soiled items that were used for the patient, such as needles, blankets, clothing, or masks that may have come into contact with the patient or the patient's bodily fluids. Also, it is important to avoid bats, chimpanzees, and gorillas, along with anything they create, such as their meals, waste, or habitats. Secondly, it is important to get vaccinated for Ebola. There are currently 2 vaccines for Ebola, one being Ervebo. Ervebo is delivered in 1 dose and protects against a popular strain of Ebola, Zaire. Ervebo is intended for adults 18 years of age and older. Since it is high in supply and only requires 1 dose, it is suitable for an outbreak response. The other vaccine is a combination of 2 medications. These are called Zabdino and Maveva. 2 doses are required within 2 months of each other. This vaccine is suitable for children who are at least 1 year old. However, it is not suitable for an outbreak response due to the lack of supply and the requirement of 2 doses. As I previously stated, there is no discrimination regarding who can get Ebola. People of all ages, genders, ethnicities, or socioeconomic statuses are equally susceptible to Ebola. As Ebola is still a relatively new virus, there is minimal research on these factors. With that being said, there are so many eye-opening statistics regarding previous cases. For example, those aged 20 to 29 have accounted for about 31% of all cases, and women have been historically more susceptible to Ebola than men. Also, since multiple Ebola outbreaks were based in sub-Saharan Africa, there are extensive cases of African people contracting the Ebola virus. However, this is assumed to be due to the location and not due to their biology. Lastly, those with a lower socioeconomic status are not biologically more susceptible to Ebola. However, if they are not able to afford the vaccine or healthcare in general, they may be more likely to contract and die from the Ebola virus. Thank you for exploring my presentation on the Ebola virus disease.